So tell me just a little bit about the situation in terms of, staffing and what's going on right now because of the pandemic. What is your reaction to, hearing that many people are out of their posts, leaving the system, thousands going into private healthcare? What does that say to you right now?
It said that the pandemic has exacerbated a situation that was not very good for the nurses before the pandemic, but the pandemic exacerbated the situation. So right now the nurses are exhausted, as you know. Many of them demonstrate psychological problems, mental health problems. So it's a very critical situation for nurses and for the healthcare system and globally in Quebec right now because of the pandemic.
And looks like many people are absent from the public healthcare system and only further adding to the understaffing of the system. How does that affect everyone?
Yeah, but the situation that you are exposed already exists before the pandemic. It's just worse right now. There are many problems with the nurses profession exist before the pandemic. As I said many times to the Ministry of Health, you have to promote nursing expertise and recognize the importance of it and the importance of the training also for the nurses. Um, Nurses are not interchangeable from one area of practice to another. And right now, I know that it is an exceptional situation that we transfer some nurses from an area of care to another. But we have to be very careful when we are doing so because we have to be sure that the nurses have the competencies, the expertise when they are transferred in a new area. And it depends what we're asking them to do in that new area of practice. By example, in an intensive care unit, if you send there nurses who do not have the expertise, you cannot ask them to take care of a patient globally. What could be acceptable is if we ask them to support other nurses who have the expertise in that domain, and you have to give them the support from nurses who have experience in that area of practice. So it all depends, and you have to also to establish better condition of practice for nurses. So you have to have sufficient ratios. You have to abolish mandatory overtime as much as possible, and a better distribution of the workload. So and many other things. So to create healthy and work environments before or after the pandemic, you have to do so. The main thing that our members tell us is to provide coaching and clinical support when nurses arrive in the profession, but in the all their career long. Because if you not give that coaching, that clinical support, in the first year of the practice, many times we see nurses leave the profession.
And that's what we're seeing a lot recently, right? People are leaving the profession or going into private healthcare where the conditions are better. And you were saying there are possibilities to make the conditions better, but do you see it as realistic? Do you think that the government could implement this? Because right now they're negotiating a collective agreement, right?
Yeah.
And it wasn't accepted recently. So how can we make this attainable for nurses to not have to do forced overtime and to not have such big ratios?
Yeah. To the point of view of the order, we make some observation. There are some clinical settings where they do not have too much problem with attraction and retention of nurses, and where also mandatory overtime is not applied too much. So in Quebec, we have the same union, same patients. So the question is why some organization have not too much problem with attraction and retention of nurses, and others do. So they are good practice, good management practice, who some organization will have to have a look and to implement them, because if nurses leave the public sector to go in the private sector, because they have a better fit with their personal life and their professional lives. So in the public sector, they have to consider that and not have a bureaucratic approach with nurses. Nurses are professional. You have to treat them as professionals. And there is some things that could be done. I said some of them to support their expertise, recognize their expertise that nurses have, to promote them, promote a better occupation of the scope of practice of nurses. That's another problem. Nurses too often do other activity than their home. Studies support that. So, and those studies said that nurses perform only about 50% of the authorized activity in the scope of practice. So they do activity that other people, other member of the clinical teams could do, such as another example. And for that situation, the organization have the power to reorganize the care, but for different reasons, I don't know those reasons, but in many settings, they don't do that.
Just lastly, I want to know about what you think of Mr. Legault yesterday was saying. We're trying our best to train as many new nurses as possible. It can't really be, accelerated too much. Do you think that there's enough replenishment of people coming from school into the system? Do you think it's going fast enough?
I don't know if it's going fast enough, but what I know, we cannot reduce the durée,
The length.
the length of the training. It takes time to form and to formate to train. It takes time to train the nurses. It takes, our point of view, takes many years, and not just at the formation initiale, the initial training, but also for you have to have a lifelong learning, thinking about nurses and the professional in the healthcare system. So because in the last months, we heard some thinking about would it be possible to reduce the time for training nurses? And it's not a good idea, not at all. As other professionals, it takes many years to train a nurse.